the year 2024. The world still bears the scars of recent pandemics. COVID-19, a stark reminder of our vulnerability. Yet, in the shadows, another threat looms. Avian influenza, specifically the H5N1 strain, has been circulating among bird populations for decades. Its potential to jump to humans and trigger a new pandemic is a chilling possibility. The question is not if, but when. History is a harsh teacher. From the bubonic plague to the Spanish flu, pandemics have shaped civilizations. H5N1, with its high mortality rate in humans, has the potential to be even more devastating than COVID-19. The 1918 influenza pandemic, a global catastrophe, serves as a stark warning. An estimated 50 to 100 million people perished. We have the knowledge, the technology, and the experience to respond effectively. But do we have the collective will to act decisively and in unison? We must use our interconnectedness to our advantage, sharing information, resources, and expertise to combat this global threat. Avian influenza, commonly known as bird flu, is a type of influenza virus that primarily affects birds. H5N1 is a highly pathogenic subtype of avian influenza, meaning it can cause severe illness and death in poultry. While H5N1 primarily affects birds, it has the potential to infect humans. Human infections are rare but often fatal. The virus is highly mutable, constantly evolving and posing a significant challenge for vaccine development. H5N1 is transmitted to humans through close contact with infected birds or their secretions. The symptoms of H5N1 infection in humans are similar to those of seasonal flu but more severe. In severe cases, H5N1 can lead to pneumonia, acute respiratory distress syndrome (ARDS), and multi-organ failure. The high mortality rate associated with H5N1 is a major concern. Scientists are closely monitoring the evolution of H5N1, looking for mutations that could signal an increased risk to humans. The year 2023 witnessed an unprecedented surge in H5N1 outbreaks among bird populations worldwide. From North America to Europe and Asia, the virus wreaked havoc on poultry farms, leading to mass culls and economic losses. In Cambodia, a worrying development unfolded as 2 human cases of H5N1 were reported in February 2023. Tragically, the young girl succumbed to the infection, while her father recovered. Genetic analysis revealed that the virus strain responsible for these cases was closely related to the strain circulating in poultry in the region. This incident underscored the potential for spillover from birds to humans and the deadly consequences that can follow. Meanwhile, in Chile, a significant outbreak of H5N1 swept through poultry farms, prompting the culling of millions of birds. The economic impact of the outbreak was substantial, highlighting the vulnerability of global food systems to animal diseases. These outbreaks serve as a stark reminder that the health of animals, humans, and the environment are inextricably linked. In light of the escalating H5N1 situation, the World Health Organization has issued a series of warnings, urging nations to enhance surveillance, strengthen healthcare systems, and prepare for a potential pandemic. The WHO has emphasized the need for international collaboration and information sharing to effectively combat this global threat. The organization has also called for increased investment in research and development of vaccines, antiviral drugs, and diagnostic tools. However, the WHO also acknowledges the possibility of a more severe scenario, in which the virus acquires mutations that enable efficient human-to-human transmission, leading to a global pandemic. Controlling the virus at its source, namely in poultry populations, is paramount. This involves implementing strict biosecurity measures on poultry farms, such as restricting access, maintaining hygiene, and regularly screening birds for infection. Vaccination of poultry is another crucial strategy, as it can reduce the viral load in bird populations, making it harder for the virus to spread to humans. Surveillance plays a critical role in early detection and containment of H5N1 outbreaks. Developing effective vaccines and antiviral drugs is essential for both prevention and treatment of H5N1 infection in humans. Public health education and communication are vital components of pandemic preparedness. Clear and timely communication from public health officials can help to prevent panic and promote trust during an outbreak. The specter of an H5N1 pandemic looms large, a stark reminder of our interconnectedness and shared vulnerability. The threat posed by this highly pathogenic avian influenza virus demands a coordinated global response, one that transcends borders, disciplines, and sectors. We must act decisively, drawing upon the lessons learned from past pandemics and harnessing the power of scientific knowledge, technological innovation, and collective action. This is not just a matter for governments and public health officials, it is a collective responsibility that falls upon each and every one of us. We must stay informed, follow public health guidelines, and support efforts to prevent the spread of H5N1. We must also hold our leaders accountable, urging them to prioritize pandemic preparedness and invest in the research, infrastructure, and resources needed to protect global health. By working together, sharing information, and supporting each other, we can overcome this challenge and build a safer, healthier future for all. The time to act is now.